Haidee and good afternoon. Thank you so much for joining our COVID-19 press conference on vaccinations. I'd like to welcome my panelists to turn on their cameras so we can see them. So again, thank you for joining us this afternoon. We have the presence of our Honorable Magahaga, Governor Lou Leon Guerrero. We also have with us Lieutenant Governor Joshua F. Tenorio. Public Health Director Art St. Augustine is also joining us. Public Health Incident Commander for the COVID-19 operations, we have Mr. Tom Nadeau. And Public Health's Bureau of Communicable Disease Control Administrator, Ms. Annette Uggen. At this time, I would like to give the floor to our Honorable Magahaga, Governor Lou Leon Guerrero, for her remarks.
Thank you very much, Crystal. Buenas and Haidee. It's been 10 months since a state of public health emergency was declared. Throughout this pandemic, the people of Guam have been asked to give so much of themselves to keep each other safe. Just with any adversity our island has faced, we came together, we persevered, and we did what was necessary. For that, I want to thank each and every one of you. We would not be here today in this pandemic level in our status without your actions and commitment to our community. Yesterday, sooner than we anticipated, we received a small dosage of hope, our first shipment of COVID-19 vaccines. As we position ourselves for the distribution of these vaccines, I know many of you are asking what's next. Based on our CAR score, and as the first vaccines are administered, we will be looking into the potential reopening of schools. Lieutenant Governor Josh and Public Health will be working with GDOE to determine their need in order to open the schools for our students as safely and efficiently as possible. But I need to stress that our mitigation measures must remain. The vaccine does not mean the pandemic is over, and we can see this clearly across the nation. To the people of Guam, we are seeing the light at the end of the tunnel, but our actions remain as important as ever. We cannot become complacent. Wear your mask, watch your distance, wash your hands. Recently, and for political reasons, some chose to criticize our strategy of leveraging federal partnerships to secure healthcare workers to compete for and win supplies at a White House level, and now to be the first territory in the nation to receive the COVID vaccines. And while criticism is expected and welcome in a democracy, much of our progress in the fight against COVID has come because of our partnerships and knowing when to call on them. In ending, I want to extend an undunklu nasidus masi to General Perna, the staff and service members of Operation Warp Speed, the United Postal Service, our federal partners, and everyone who has played a key role in making this happen.
Thank you so much, Governor. I now like to welcome Lieutenant Governor Josh Tenorio to make his remarks.
Thank you very much, Crystal. I just wanted to echo and support the governor's statements. And quite frankly, I'd like to defer to the media to ask her questions so we can get the information out to the general public. So thank you.
Thank you so much, LT. Art St. Augustine, Director of DPHSS, will now have the floor.
Hi, Crystal. I don't have video control. I'm hitting video. Oh, there. Okay, thank you. Good afternoon. Good afternoon. And like the Lieutenant Governor, I too echo many of the sentiments our governor has expressed this afternoon. She has eloquently stated many of the thoughts and comments that we would like to express. So let me then instead share this information with you. Yesterday was extremely historical and significant for public health and social services, really for the people of Guam. Our first order of Pfizer vaccines arrived. And just as much as the arrival of the vaccines is significant, Even more significant is it arrived safely. It is in a secure location. It is monitored 24/7, and it has security on site. These vaccines are instrumental in our fight on island, as in the nation, against COVID-19. In addition, not only did we receive the vaccines yesterday, we also placed our second order of Pfizer vaccines, 7,800 vaccines. And that totals 11,700. That is our December allotment for the Pfizer vaccines. And prior to yesterday, on December 12th, we also placed our first order of Moderna vaccines, or what they refer to as Vaccine B, 3,800 doses. We have been allotted a portion, 7,600. That is our first of two orders for Moderna. When both Pfizer and Moderna arrive on Guam for our December allotment, we will have a total of 19,300 vaccines in which we can then immunize 9,650 individuals on Guam. As many of us know, and many of you know, each vaccine, Pfizer and Moderna, require a first and second dose. And so as the governor has thanked many, I too, as the Director of Public Health and Social Services, want to thank the governor, the lieutenant governor, the men and women of public health and social services, all our local and our federal partners for the months and months of work that they put together. And even as we're planning for our first closed clinic to vaccinate tomorrow, the work continues. This is just the beginning to the end. And I want to really thank everyone for the hard work, the dedication, the time, commitment, and sacrifice you have all given to the community. And I want to thank again the support of the administration, our governor, Lou Leon Guerrero, and our Lieutenant Governor, Josh Tenorio, who have been extremely supportive to public health and social services. And I want to thank my staff in the end. Thank you all very much. And I will pass it on to Annette, who can really talk more on the details of the incident commander, perhaps on the actual clinic site tomorrow. Thank you very much.
Annette, please unmute. Annette, you've been unmuted. I'm sorry, Annette, we still can't hear you. Annette, we still can't hear you. I'm sorry, Annette. May you take off your headphones? Maybe that's prohibiting your speaker microphone. While we try to fix Annette's audio issues, may I defer back to Director of Public Health, Art St. Augustine, to talk a little bit about tomorrow's Okudu vaccination plan.
Sure. Okay. Absolutely. Thank you, Crystal, for that. And Annette, the minute you're ready, please let me know. I'll be happy to send this over to you. So she's our vaccine ops lead, and so she definitely knows all the great details for tomorrow. But basically, tomorrow at 8 o'clock in the morning, we will start the administration of the COVID-19 vaccine from Pfizer. We have 5 stations, and so I'm just going to give you the quick highlight of the 5 stations, what you could expect. And again, tomorrow, as a reminder, is for our healthcare professionals. So Annette, just signal me when you're available to speak, and I'll pause and transfer over to you. But the 5 stations we have are check-in, processing, triage, vaccination, and post-op. And so we check in really, they want to first and foremost check if you're on the list, if you have any current symptoms when you show up, whether you've been exposed in the last 14 days, or perhaps if you've been COVID-19 positive in the last 90 days. And so there's some of the checking questions they'll be checking with those that come in tomorrow for the vaccine. Then the second station, or station 2, is our processing. And that's where they'll work on the consent form and all the paperwork that's needed for you to be administered the vaccine. And just as a cautionary and necessary step, our third station is triage. And this is where our healthcare practitioner will assess the healthcare person coming in for the vaccine to be certain that they are suitable to take the shot. And after you've been cleared on station 3, you'll move on to station 4, where the actual vaccination will take place. And then we'll move you on after that on to post-op, which is station 5. And you'll be observed in 15 to 30 minutes on site with no obvious reaction that are adverse in any way. Of course, you'll be asked to continue to monitor yourself, but then you'll move on and leave for the day. Otherwise, if for some reason we do need to respond, we want to assure the community, even with our healthcare practitioners, that we will have an ambulance on site and we are prepared for that scenario as well. And so also the vaccines tomorrow are only going to, well, we don't have any healthcare practitioners, I'm sorry, that are as young as 16 that I know of, but we were talking about the EUA at this time. So that won't apply to tomorrow. And so that's our stations for tomorrow. And I'm not sure if Tom is able to get onto the call, but he may have additional details that he may want to share with regard to the station and the flow tomorrow. And that's what we're anticipating will be the flow for tomorrow's first official clinic to administer the vaccine to our healthcare practitioners. And that's what we have for tomorrow at this time.
Hi, Art.
While we figure out Annette's audio situation, I'd like to actually defer to questions from the media. Annette will try to switch rooms or change computers in the interim. So our first question goes to Nick Delgado from the Guam Daily Post. Nick?
Hey, off day, everyone. So congratulations on getting this far in the process to get the vaccines, not just here on Guam, but to our frontliners who need it most to take care of us. So my question, just for clarification, you mentioned that part of the 5-step process, you want to make sure that the patient is certain that they are suitable to take the shot. What does that mean by being suitable, and why did we choose Ukudu as the site?
Well, in terms of the triage, they want to be sure that although there was a check-in process, that nothing was missed. It's just another measure to ensure that the person coming in doesn't have a high fever, is not known to have a high reaction in terms of allergies to the contents of the vaccine. Okudu actually was chosen because how suitable it is as a facility. It has ample space, ample parking, and for example, if when you come in, they looked at the flow where you're able to walk in, get processed, get vaccinated, and then over by the Okudu site that's in their cafeteria, you can then move on to a separate room where there's a gym. And you won't believe it, but the school is being prepared also, just as many places are. And so the principal up there has already marked all the bleachers that are 6 feet apart. So our healthcare team or people that come up tomorrow to get vaccinated, they already have pre-designated seating assigned in terms of spacing. And the principal and her team are also stepping up and providing chairs, folding chairs onto the gym floor. And it's also very suitable because when you enter, you're never going to cross back. You enter, you get processed, you go to post-op in the gym. From the gym, it also has an exit door. And so you're able to just exit and then move on, and you'll be done with that process. So of course, you know, when the triage is just making sure that you also have no fever or other related symptoms. So it's just another cautionary step to be sure that the person is clear to get the vaccine. If you have symptoms, we will not be administering the vaccine to that person tomorrow, to the healthcare.
Okay.
Thank you.
And Governor, I was interested to know about what the government or what your administration plans to do for people who still have that concern and want to hold off for their safety or even question the effectiveness of the vaccine. That's something that's happening also globally with the same concerns. What is your administration or what is your message to the people to share that your confidence in this vaccine?
Thank you, Nick. First of all, this is a voluntarily choice of the vaccine. So what we have done with our administration is try to push out as much information as possible to understand the safety and the efficacy of this vaccine. Additionally, FDA and of course its independent party have stated and have shown that this is the first vaccine that has to go through this great scrutiny in making sure that that it is safe and making sure that it is effective. I would also say that the information, the clinical trials, the data review and analysis, and the scrutiny is done by scientists, and they're done by medical professionals. These are the experts in the area of vaccination, in the area of its production, in the area of its clinical trials, in the area of, again, the number of people that they had in their clinical trial, the duration of the clinical trial, and so forth. So I would encourage people to read as much as they can, research it, read as much as they can about the vaccine, about the clinical trials, about the safety, and then make your decision. But it is voluntarily done. We encourage people to take the vaccine. We encourage people to again, do it to protect themselves and their families. So, Nick, I can only say that be read up on it, be informed, make the decision. But I do encourage the administration and the taking of the vaccine, as it's one way to protect our community, and it's a start in the direction to try to go back to some normalcy like pre-COVID times. So basically educate, be informed. You will see that it is safe, it is effective, and again, backed by science and data.
Thank you, Nick, for your question. I'm going to go ahead and turn back to Annette Uggan from the Bureau of Communicable Disease Control. Annette? She's actually calling in now.
Hi, thank you, Crystal. My apologies for the audio. And thank you, Director Yes, for doing the walkthrough on our logistical setup. And again, our most important thing is to go through using the national recommendations to follow a prioritization for our high risk, be it from their job or due to medical conditions. So yes, we will definitely be following our phases. And tomorrow we will focus on our frontliners, who are the healthcare personnel, as well as our EMS. And again, we have been receiving a lot of information and calls from our healthcare providers who want to have either themselves and their staff immunized. And so we are working on that. And again, we will verify information because it is a limited amount. We want to make sure that we are having people who are identified as the frontliners to receive the vaccine first. And we will ensure safety by always screening, making sure no one is symptomatic if they're coming in for vaccination. And that is something we do for any type of vaccination, routine or COVID. Again, if someone is symptomatic, you should not be getting the vaccine. We want to make sure that anyone who has been exposed within the last 14 days, you should actually be quarantining. So even though you would like the vaccine, we do ask that you wait until you are cleared, and there will be future opportunities for you to be vaccinated. Also, it's recommended anyone who's had COVID disease within the last 90 days to please afford these limited doses to your colleagues in the front line who do not have antibodies, to afford them the opportunity to be vaccinated first. And so we will make sure that is being checked at the door. And then if everything is cleared, you will proceed in, again, as my director mentioned, for processing to do the consent form. We will make sure, again, safety being of utmost importance, that you will have to be screened if there's any questions or concerns. And like as mentioned by the governor, this is just recommended. We highly encourage. No one is required to receive the vaccine. And then again, once you are vaccinated, we will observe you post-vaccination for at least 20 to 30 minutes to ensure your safety. Individuals can stay longer if they're like, but there will be material provided to the recipients, the fact sheets on the vaccine. And again, there's guidance there to monitor yourself for the next day or two, as there, should you have any side effects, and to report that. And any individual who does report any side effects, again, that is of utmost importance to us, and we are required to report that. So again, it is a screening process that we will do not just for our healthcare providers, but as we expand out to the other phases, and then eventually to the general population. This is something that we do with routine vaccinations, and we will do it again for the COVID. Thank you, Crystal.
Thank you, Annette. Apologies again for the audio issues. The next question goes to Haidee Eugenio. Haidee.
Good afternoon, Governor.
Good afternoon.
Since the vaccines are here and there will be more coming in the next few days or weeks, when will you, or what is the tentative date for reopening Guam's tourism? Will you go to Taiwan next year to try to encourage their citizens to visit Guam?
Okay, so our decisions in lifting restrictions is as consistent as it was, and that is we look at the science and the data that's collected with our testing and with our metrics, which of course, we look at hospitalization rates, we look at our CAR score, we looked at our positivity rates, we look at all those new cases that are coming up. What's the number of that? How does that compare to what we think the trend is coming to? And so those are some of the metrics that we will be using to determine those lifting of restrictions that you mentioned. And so as I look at this, Haidee, it's probably, when I look at this, it probably won't be till the first quarter of next year. And that's so that we are assured that we maintain and we sustain the low numbers to, again, guarantee that we are containing the virus. Additionally, of course, with the vaccine implementation and administration, this will give us more protection in terms of transmission. And so those are the kinds of elements that I will be looking at in order to make a decision. However, we've been working with GVB and the airport to be prepared once we make that decision.
So, Governor, will you be going to Taiwan? I think it was mentioned by former Governor Carl Gutierrez.
Taiwan, I'll tell you, Taiwan has been working very closely with GVB and my administration they're very anxious for us to come. And it's very encouraging for economic diversity and also for increase of tourism to our island. So we've been meeting with key officials from Taiwan. They do want us to come, and we will come as soon as it's safe, as soon as Taiwan also has a quarantine protocol. And so the circumstances permitting, yes, I will go to Taiwan.
But Governor, before you go to Taiwan, will you be vaccinated first? And the other members of the team?
Of course, everyone's going to be protected. I'll tell you, Taiwan is not a concern for me. They're like, I think they're the only country really that hasn't had any surges. And they are, for a 23 million population in Taiwan, they only have I think about 500 and some positive cases and only 7 deaths. We are a population of 167, and we have over, I want to say over 7,000 positive people and 119 deaths. So Taiwan is a very safe place.
Thank you.
We
Haidee.
want us to be safe so they can come.
Thank you, Haidee.
Thank you.
Thank you, Governor. Peter Santos, KUAM.
Good afternoon, Governor and panel
Hi,
members.
Peter.
So public health had their hands full with tracking COVID positive cases in home quarantine and isolation. What plans are in place to track the status and condition of those who have been vaccinated?
Maybe Annette might be the more appropriate person to answer that, as they have technology and so forth. Go ahead, Annette.
Thank you, Madam Governor. That's a very good question, Mr. Santos. We are actually working with all enrolled COVID-19 vaccine providers. We have public and private providers who are partnering with us on this effort. They are required to report vaccine usage into our immunization registry because we are required to report this up to CDC. And then for any type of vaccination, routine or COVID, we are required to monitor for vaccine safety purposes. There is a national vaccine adverse event reporting system that our providers, as well as the immunization program, must report to if there's any type of side effects, and that is tracked at the national level. And so there's documentation that is submitted. That by entering into the registry, we are also tracking which vaccine brand you are receiving, because again, we want to make sure that we're giving it at the proper spacing and the same brand. So yes, we will have that monitoring in place, sir.
Thank you. And so vaccines are on Guam. Our CAR score has been maintained below 5 for the past couple of weeks. Should we anticipate the emergency declaration to be lifted at the end of the month when it expires? Or
No.
No?
Don't anticipate that. Because we're still in a health emergency situation, Peter. In fact, I want to emphasize this, that although we're going to be vaccinated, and although our CAR scores are, remain low as we want it to be, we still need to continue on with our public health preventive measures. And that is wearing your mask, social distancing, washing your hands, and adhering and complying to these directives. Because once we start thinking, the vaccine is not going to remove the virus. The vaccine is going to only allow us to be a little bit protected, but we need to reinforce that protection by continuously wearing our mask and doing those directives and preventive public health mitigation efforts. So your question is very pointed, and it will not lift the public health emergency by the end of this month.
And what about PCOR 1? Will we be getting out of that?
We will probably continue on PCOR 1. And based on what our numbers are showing, we might also be able to lift other restrictions, but we will probably be continuing on to PCOR 1. And one of the reasons for that is we really want to monitor, we really want to make sure that our hospitalization is stabilized. And if you look at our hospitalization data over the last couple of weeks, it can go anywhere from 24, 25 to as high as 40. And so we want to make sure that that's stabilized and that decreases much more than what it is today.
Thank you, Governor.
Adriana Cotero from The Link.
Hi, everyone. So I know Annette briefly touched on the screening process, but if we could go a little further in details to just note what some of the allergies are and also highlight on that process and any safeguard measures altogether to inform those who should not take the vaccine.
Thank you. Good question, ma'am. Yes, the screening questionnaire will ask, do you have any allergies in the vaccine component? And so we will have that information available so that as we're screening you, so if you have any allergies to a component of the vaccine, then you should not be getting the vaccine. Then when it's time, if you get the vaccination, and then it's 21 days later for the Pfizer vaccine, it's time for dose number 2, then we will be asking you, did you have a reaction to dose number 1? What was that reaction? If there are any concerns, we will seek medical guidance and clearance that does the risk outweigh the benefit? Because again, it's all about vaccine safety. The vaccine, like any other medication, there are some people who will have side effects. And so again, we always want to screen those individuals out. And if you do have a valid reaction or allergy to the vaccine, we will not be able to afford to give that to you. And so that's why it's critical for those who can receive it. We want them completely immunized, because then not only are you protecting yourself from when you get the vaccine, you're protecting those who cannot get the vaccine, be it because of age or medical condition or an allergy.
Okay, thank you. And just to kind of piggyback off of that, we know there's many things being speculated and ongoing discussions on the matter of side effects, but from any, federal government deliberations or discussions between public health officials, doctors, and scientists, what are some of the more potential severe adverse reactions and more are the major long-term and short-term side effects?
Well, long-term, we cannot answer. Again, this vaccine was just recently developed and given EUA approval. The companies will be doing ongoing continuous safety monitoring of the vaccines. And actually with FDA, they are required to at least do it for a minimum of 2 more years. So again, it's ongoing. Recommendations will be changed as new information is made available based on the science and based on the ongoing studies and research. Similar to any other vaccine, we adjust based on the most current and recent data. And again, we will go through FDA approval of those changes and waiting for the CDC and the Advisory Committee on Immunization Practices. So for any type of reaction, any vaccine, you're looking at the local systemic pain in the injection site, some swelling or redness in your injection site. You may have the possibility of a fever. Then the concern we're having with this vaccine that we've heard, people are complaining about headache or migraine headache. They feel tired for a day or 2 afterwards. Then we've had some individuals who said they felt fine based on the information that we're hearing from others who've already received it in the nation on the mainland, that there have been already some interviewed and saying, I was fine, I had no problems. Some had minor issues and they're okay. So again, every individual is different. Their response will be different. And so that's why we definitely want to observe an individual, for a minimum of 15 minutes. Someone may want to stay longer, but we want to make sure that you are okay after you get this first dose. And again, educating them that you may have some type of side effect in 1 to 2 days, and so that you also to monitor that, report it to us if we're the ones who vaccinated you, or report it to the provider that immunized you, so that can be recorded and reported to not only the immunization program, but also again to CDC through that national vaccine adverse event reporting system.
Thank you.
Thank you, Adriana. Now to CJ Akiko, Pacific Island Times.
Half a day, Governor.
Half a day.
Hi. A couple questions. What is the percentage, maybe a number of Guamanians? What's the goal for the immunizations? And also, what is the timeline?
Annette, you want to answer that?
Yes, ma'am. Our goal is to immunize as many of our residents as possible. However, that is dictated on the vaccine production by each manufacturer. And again, our allocations are based on our population, and so that at the national level, it's being distributed out to 64 jurisdictions across the nation and the territories. And so we will, as we get our allocation, we will push hard to vaccinate as quickly as we can to bring up that immunization coverage rate. And so again, this will take several months. Right now, the Pfizer vaccine is only approved for individuals 16 and older. And so that's why we have to do this phased approach. As we get limited amounts of vaccines, we need to prioritize those that will give us the most benefit to reduce the risk of COVID in our community. And then as we get more information and the vaccine is approved for individuals under 16 years of age, and again, they're estimating maybe spring or summer, then that's when we will now start to expand out to the other groups in our population. So this will take several months. And so again, one dose is important, but that gives you half of the protection afforded of the vaccine. So we really need to make sure individuals come back to complete that second dose in a timely manner. And then we will slowly start to see our vaccination coverage increase over time, but it will take several months, sir.
Thank you. So with that said, 16 years and below are not going to be immunized. Is there any news available on bridging that gap for the children of school age?
Yes, the vaccine manufacturers are already in the process of immunizing in their phase trials for individuals less than 16 years of age. But again, this will take several months of the vaccine trials, of monitoring, recording that information, analyzing it and making sure for vaccine safety and efficacy. And then if the science and research is good, the results are good, then again, they go through the process of going to FDA to have this updated recommendation for the younger population. And then they will push it out after we get the CDC and the Advisory Committee on Immunization Practices approval. And then we will update our recommendations and our standing order. And then we will start to bring in the younger generation to be immunized when those vaccines become available.
Thank you, and congratulations, guys.
Thank you, CJ. Jarek Sablon, PDN.
Hi, good afternoon. I wanted to find out, because of the vaccine requires cold storage, how are you guys bringing it to Ukuru? Is there going to be dry ice involved? I wasn't sure. And how are you guys going to keep it super cold when it's at Ukuru? How are you going to keep it viable?
Thank you, sir. Yes, we have been preparing for our vaccine storage because of the sensitivity for the Pfizer vaccine, which is ultra low cold temperature, around minus 70 degrees. So thankfully, in partnership with the Division of Environmental Health, we also have like BOM, EPA, that they have their own ultra cold temperature freezers that we can use to store our vaccines. So in these freezers, the vaccine is viable for 6 months. Before you administer this vaccine, you actually have to thaw it out and reconstitute it. So when we bring it out into our outreach, then this gives us 5 days to use the vaccine. And so again, we will be bringing out limited number of doses. We will monitor our flow, how many individuals we have left to immunize, because this is a 5-dose vial. And once we have it in what's called the refrigerated or thawed state, then we can use it out in the field. We have specific portable vaccine transport coolers that we will be storing it in while we're out conducting an outreach, be it here at Ukuru or any other site. Similar situation will be for the healthcare providers as we receive any future allocations and we start to push out to our enrolled partners, that they will be able to store it in their respective facility so that they can immunize based on their schedule and their staffing. So yes, sir, that will be the process.
Thank you, Annette. And also, you guys are doing this kind of mass testing. Is this, in the future when you guys start doing the general population, is this kind of what you guys are hoping to do once it gets available to the general population, like kind of these mass vaccinations, like at Ukuru or maybe another school? Is that kind of the plan moving forward?
Yes, sir. Initially, we will do what is called closed points of dispensing because of the limited doses, and we need to make sure we're targeting the right prioritized individuals. And then as we get more vaccines out, we will have more opportunities through our enrolled vaccine providers, public and private sector. And then public health will be conducting mass vaccination clinics. And the plan is to do it at different sites throughout the island to afford our residents at various parts of the island to be able to come to somewhere closer to be vaccinated.
Thank you, Jarek. Moving on to Luella Lucino. Luella Lucino?
This is Gerry Partido from PNC. I'll just ask the questions on behalf of Luella. And my first question is, after the essential workers and the elderly, how will the prioritization for the rest of the public be determined? And will the governor, the cabinet members, and other GovGuam officials be on the priority list for those to be vaccinated?
If I may, I'll answer that, Madam Governor, that yes, we have a phased-in approach following national recommendations. We have already reconvened our Vaccine Antiviral and Prioritization Policy Committee, the VAPPC. For short, we're just calling it the Vaccination Committee. That will look at these national recommendations, and then we will refine it to meet our local needs based, again, on what is happening in regards to cases, the age or the medical conditions that are highly affected, and we refine it to match what is needed on Guam. Every jurisdiction is different. Their outbreak status is different. And so that's something that we will further refine to meet Guam's need and to prioritize based on the data that is available and who do we need to target it. But yes, essential critical infrastructure workers are considered under phase 1B. As the government leaders, our governor and lieutenant governor are critical to ensure that the government is running and the island is running. So yes, they are also in that category for receiving it as a priority group. We have been gathering data for the past several months, not just for the public side, but also on the private side for like transportation, for food, and so for fuel as well, communication and technology. So this information we've been gathering from our various stakeholders. We know we do not have enough vaccines to push out to everyone at the same time. So again, we've been asking our partners, tell us who are your critical employees in the tier 1, tier 2, and tier 3. So as we get more vaccines, we're going to pull up who you say are your most essential in your respective organization. And even our nonprofit partners, they're critical for us that we have asked this information. And then as we go through with guidance and we make any refinements through the vaccine committee, then we will start having more immunization outreaches for these identified individuals. And again, to be fair and equitable. And this is where the committee will vote on how to be as fair as possible to provide it across the board as we slowly phase in vaccinating our residents.
For my second question, what percentage of Guam's population needs to be vaccinated for us to get herd immunity? And can we be assured of having an adequate supply of vaccines to achieve this? And how long does the effectivity of the vaccination last?
So all good questions, sir. Unfortunately, we cannot control the vaccine production. That should there be a batch that's developed and it does not meet the standards for quality and safety, then those vaccines will not be distributed. So again, we cannot control that. So that's why our allocation numbers have been fluctuating up and down. And again, that is something that we will be monitoring as CDC tells us what we are allotted. And so again, this will take several months. There have been information, herd immunity will be very difficult to reach anytime soon. One, because there's not enough vaccines out there. And then you need 2 doses on top of that to be considered complete. The other issue is, as the governor has mentioned, this is not a requirement. And so again, we have individuals who will not receive the vaccine because they don't want to. And then there's others who cannot receive it due to, again, certain conditions. So again, the The faster we can immunize our people safely, the more we have immunized will help us. And again, it's still, even if we vaccinate, we still have to practice the 3 Ws as our governor has mentioned, because this will still be several months down the line where we have enough vaccines to even have people complete their 2-dose series.
Okay, thank you.
Thank you, Gerry. I'd now like to turn to Tom Nadeau, our incident commander for the COVID-19 ops. He's been quiet so far. Tom?
Thank you, Crystal. Thank you very much. Well, I'm pleased to state that our dedicated, hardworking public health incident management team, we've been working diligently in getting the Okodo site prepared for tomorrow's event. The facility will begin operation promptly at 8 a.m. Until 3 p.m. Then we'll continue the operation on Friday and Saturday, but we'll start an hour later, about 9 a.m. to 3 p.m. After each day, our team will review any challenges that may have occurred to ensure we correct or adjust them for the following day or the next event, and also to build upon our successes. We're very excited and we're very prepared for tomorrow's kickoff. Thank you.
Thank you, Tom. Lieutenant Governor, any closing remarks from you?
Thank you, Crystal. I just wanted to say that we're really beginning this next phase in our response to the pandemic. Now that we begin the vaccination process, you've heard Annette, it's going to be months and months while we get the adequate supply to meet the priority groups that the federal government and our local vaccine committee will be setting forth. But there's also been expanded testing. I just want to encourage people, as the governor has said, it's our intention to continue to provide testing options for the people of Guam so that they can go out and verify their status and mitigate their risks. This includes testing offered to private sector employers. And that's something that the governor has been working strongly to make sure that we have adequate testing and access to testing to facilitate this next phase in our pandemic. The other thing is we have additional treatments, and GRMC and GMH have additional medications that are being given to positive folks that are in high-risk categories to reduce the hospitalization risk or the seriousness of the illness. And of course, the safety protocols that we will continue. Wash your hands, wear the mask, watch your distance, and of course, make sure that we have the willpower to be patient and to be understanding. I just also want to add that as we stabilize ourselves and maintain this posture, we should be still interested on about what's happening beyond our borders. The situation in the United States is getting more and more dire as the days and weeks go on. If you're watching international news, you'll notice that the governments of Japan and Korea are taking additional precautions and measures because of increases in cases. This influences the decisions we're making about the quarantine protocols, about the additional guidelines that we're drafting to have additional liberties. But we can't take things too fast. I just say that we're in the long game here. We need to make sure that we do everything we can to make sure that we keep the virus under control and utilize all the resources that we have to try and ensure patient safety, reduce the amount of people going into the hospitals, and to target high-risk populations that are most vulnerable to the spread of the virus. So I just want to recognize and thank the people of Guam for taking us from a very bad situation where outside introduction of the virus caused our island to have more than 7,000 cases and more than 100 deaths, 119 souls that have been lost. We don't want to get back into that situation. And I know it's hard. Businesses are hurting. Some businesses are closed. But this sacrifice that you're making really is going to help us return to a more normal phase or new normal much sooner than many jurisdictions elsewhere. So I just want to thank all of the people for what they're doing. I want to wish them a safe holiday season, and we continue to be there to try and provide as much assistance to the people of Guam as we can. So thank you very much.
Thank you, LT. And last but not least, Governor Lou Leon Guerrero for her closing remarks.
Yes, thank you very much, Crystal. I'd like to thank Public Health and the leadership of Art and Terry and Lori, and also to the very detailed attention to detail processes and procedures of our immunization division, and also for the vaccine. I'd like to say that and assure the people of Guam that Public Health is very prepared, and they are ready to provide the vaccination to our people. So I want to assure our people that this is the direction that we will be doing, and more so even with more vaccines coming in. But I also don't want to take our eyes off the ball with monitoring community spread. And so we will continue to be aggressive in our testing program. Art has assured me 2 or 3 more times that as a result of it, we will continue our community testing, because we cannot take our focus off the community's testing. Vaccines, of course, is one of the tools, but it is not the only tool that we will be using. So we still need to watch our community spread. We still need to do our mass testing. We still need to continue on with our surveillance, our monitoring, our data collection, and so forth. So nothing is going to change in that area. And in addition to that, we will have our vaccination program. I'm very encouraged with this hope for our future and the hope to try and return back to as normal as we can. And we can't get there without, again, the continued support of our community and the continued diligence and commitment to get this virus contained. So again, as the Lieutenant Governor had mentioned, I want to thank the people of Guam for their sacrifices, their struggles, their challenges, and again, to be a little bit more patient with this crisis so that we can once and for all contain this virus. And again, wear your mask, wash your hands, watch your distance. I know repeating and repeating and repeating, but really that is the key to keeping us safe and protected and to save lives. So thank you again for your great patience, tolerance, support, and cooperation.